Hello, my name is Dr. Stephen Mulholland, President and founder of Spa Medica. I've owned and operated this private surgery center for over 25 years, and we serve thousands and thousands of Canadian patients in our facility. One of the most common things I've done over the years, a couple thousand of them, is a tummy tuck. A tummy tuck. What is a tummy tuck? A tummy tuck is a surgical procedure designed to improve one or more of several tissues of a tummy that can change with age, with weight loss, or pregnancy. There are different types of tummy tucks. There's mini tummy tucks or skin pinch mini tummy tuck, where we just remove some of the loose skin and stretch marks that you can get from weight loss, weight gain, or childbirth. There is a standard tummy tuck, where we remove not only loose skin and extra fat, but we tighten the muscles, the core muscles, the rectus abdominis muscles, and we bring them together. And we make a new belly button. So belly button, skin, fat, and muscle. Then there is the extended tummy tuck. The extended tummy tuck also works on the rectus abdominis, the muscle in the core, the belly button, removes fat and skin, but it extends the incision around the hip bones to the back, and then often includes a lot of flank, love handle, and back liposuction. So mini, standard, and extended tummy tucks, all designed to improve truncal figure, contour, shape, and form. The best candidates for tummy tuck are those patients that have extra skin and fat as a result of weight loss or childbearing, patients who have a weak abdominal core and herniation of intra-abdominal contents or separation of the rectus muscle called rectus diastasis, or herniation of their belly button, or unwanted fat of the lower abdomen, upper abdomen, or side flanks, or any combination of those elements are good candidates for tummy tuck surgery. If you're medically well and you understand the risks and the benefits and you've set aside time for recovery, we can make a tremendous improvement in your abdominal and flank contour. Typically, recovery from a tummy tuck depends on the kind of tummy tuck. For a mini tummy tuck, a skin pinch tummy tuck, typically the recovery is about a week. You're wearing a garment, you have some dressings, the incision's very low down, hidden in the pubic area, and you may or may not have a little mini drain. Typically, you're back to work after a week. With a more standard tummy tuck, which is muscle, belly button, and skin and fat, you're going to have a very low pubic incision along up the groin creases to the hip bones. You may have 1 or 2 drains, you have a garment and some dressings, and you need 2 weeks off. Typically, you're back to light activities after 2 weeks. Elliptical, stair climber, mild exercise at 3 weeks, and you're back in the gym doing crunches and sit-ups and core work at 6 weeks. With an extended tummy tuck, where we go around the sides and we do liposuction in addition to muscle, belly button, and skin, you typically need 3 to 4 weeks off because it's a total torsal transformation. And again, you're back to light exercise at 4 weeks and unrestricted exercise at 6 weeks. There are some non-surgical alternatives to tummy tuck surgery down in our Spa Medica Medical Spa. We have tremendous technologies for killing fat, like cool sculpting, sculpture, the Evolve. We have tremendous technologies for tightening skin without surgery, such as the Evolve Tight, or the Venus Freeze, or the Exless. We also have technologies that can improve stretch marks, such as our fractional RF technologies like the Morpheus. We even have technologies, non-invasive, that can build up your rectus abdominis muscles, close the gap a little bit in that separation, and that's called the M-Sculpt. So there are some alternatives to tummy tucks. They involve multiple technologies, and we have them at Spa Medica, and they're very popular. Many patients ask and worry about tummy tuck scars, and you can see all kinds of horrible scars on the internet. Typically, a well-trained plastic surgeon with lots of experience is going to have all kinds of tricks to hide your tummy tuck scar way down low, below the typical underwear line, at the junction, or even within the pubic hairline, and then up the groin creases to the hip bones. So you are going to have a scar, but you get to work with your surgeon, with me, to show me where you want that scar to go. The goal is to keep that scar low, and then we offer at Spa Medica, and I've done this for 20 years, complementary scar treatments. You can't just assume oh, let the scar and Mother Nature heal thyself. It isn't going to do it well sometimes. So we are going to use laser techniques, silicone topical gel techniques, injectable techniques into your scar to ensure it is flat, it is light, it is low down, and is inconspicuous. Over 1,000 women have chosen Dr. Mulholland as Spa Medica for their tummy tuck because we do a great job, lots of experience. We have lots of the best technology to ensure that your body-tight liposuction gets contraction, and we commit to treating your scar and your post-op tummy tuck with ongoing treatment. So I combine my non-invasive body contouring program with your tummy tuck. We do the surgery, get you healed by 12 weeks. We don't stop with good, we go for great. We put you on our non-invasive tummy tuck program, and you get technology like sculpture, cool sculpting, the Evolve Tight and Trim, and the M-Sculpt. So by the end of 1 year, you have all the benefits of my tummy tuck surgery and all the benefits of non-invasive technologies to have the tightest, firmest, flattest tummy with the lowest, most inconspicuous scar that you can possibly get. That's why people choose Spa Medica. For over 20 years, I've done television shows that educate and help women understand what a tummy tuck really is. Let's take a look at some of those shows.
We're talking tummy tucks.
And it'll actually be the tightest part of your body for the rest of your life. You may, the face may sag, you may get droopy, but you'll still have a 25-year-old tummy forever.
The price of a better belly
is going to be under $10,000, between 5 and 10 depending on the practice.
Okay.
A bigger transformation is going to be over 10,000 but less than a Prius. Something like that.
Well, this is just incredible. Through diet and exercise, Patricia Marnock lost 120 pounds all on her own, but this left her with a lot of saggy skin, so she went to see Dr. Mulholland.
Today's the big day. We get to take that frustrating extra soft tissue, that fleshy stuff, and throw it away.
So now that I've lost where I feel I can get to with the weight loss on my own, I'm finding that I have all this skin around my midsection, which is affecting the clothing that I buy. I find I have to buy larger pants to fit my belly, but what happens is the waist is too big. I just want to be able to go on a shopping spree, buy what I want, not worry about will it hide my stomach. I really want to start feeling good about what I'm wearing, not just to hide it.
So all this extra tissue, the extra skin that can happen after babies or after weight loss, we're going to throw that away so you get a nice tight contour. Tummy tucks have been made a lot simpler recently because a lot of our tightening and our soft tissue contraction can be achieved with devices like this. This is the Body Tight. It emits radio frequency electrical current between these two probes. It removes some of the melted fat and tightens the skin, minimizing the need for long cuts. And so Body Tight is usually the first part of every tummy tuck.
Hi, Patricia here to see Dr. Mulholland. Thanks.
You can see a tremendous improvement in your front and your waist and side view. If we turn slightly just a bit, really looks good.
The surgery was 4 months ago, and approximately 3 weeks after the surgery, I started returning back to work, trying to resume a semi-normal life. For anyone who would consider doing the surgery, the key is make sure that you exercise a lot. Get yourself in shape before you do the surgery. Read up on the internet, look up any procedures, talk to people who have had it done, prepare yourself for what you're going to face so there is no unknown.
Any subsequent weight loss that you now have, you'll shrink symmetrically because you've got the snap back in your elastic band. The skin is now able to respond to some weight loss.
The first thing I saw when I took the Band-Aid off there, I thought, oh my God, I have a belly button where it should be. So it's like, as small as it is, it's my biggest pleasure. Just getting comfortable in my body again is a little bit of a issue for me, but it's a good one. It's a good challenge, one I'm up to.
Now that is a transformation. You just should have heard the audience just in awe. So, Dr. Mulholland, let's talk a little bit about this. Patricia, 44-year-old, she had no kids, but we know that there are a lot of women watching who do have kids who are dealing with that same skin issue. Yeah. And as you said, you can't exercise away skin, right?
The two best candidates are people that have had weight loss, weight gain, and then sustain that weight loss, or they've had children, multiple kids, they've stretched the elastic band and it doesn't come back. So good medical condition, and you've tried diet and exercise, and then you still have a little pot, a muffin top, or loose skin, that's the best candidate.
That's the best candidate. Okay, let's talk a little bit about how long it took for her to go from laying on that table to looking that amazing. Like, what's the recovery like? How long?
Well, it's really important to remember that it took, you know, 25, 35, or 40 years to get there. A couple of kids, weight loss, weight gain. You really need to count on 2 weeks off for a mini tummy tuck, maybe 3 weeks off from a major tummy tuck. A lot of what we do around the back side, and tummy tucks really are front, side, and back, bra line, flank, hips, and then removing the loose skin at the front, tighten the muscle, can be done through little incisions and tightening devices. And so I tell all women, take 2 weeks off, 3 weeks if it's a big tummy tuck, and you're doing light exercise at 3 weeks, and then high impact exercise, sit-ups at 6 weeks.
So was Patricia's considered a little or big?
Hers was definitely on the bigger side of things.
I want to know where her scars were. When you saw her showing that flat tummy with the new belly button and everything, it looked amazing. Where were all of the scars?
Well, a little plastic surgery magic. So we tried to hide it in positions that are relatively inapparent in any clothing. So usually way down by the pubic hair, for example, if you've had a C-section scar, that's the length of a mini tummy tuck. The C-section scar above the pubic line out to the hip bones would be typical. And then all the other tightening, bra line, hips, flanks, are a little 1 millimeter incisions that allow the tightening devices under the skin.
Okay, so you're taking weight, as you mentioned, from all around, and a lot of people don't think of that. They think tummy tuck and they just think the front. Why is it important to get in the back there?
Well, you know, and women will tell you this, they're very flat in the tummy, but they have that annoying muffin top that hangs over their jeans or tight slacks. So you gotta follow the muffin top right around the entire muffin. And usually that's above the bum, flank, sides, and bra line. The flesh that hangs over the tight bra line is also very annoying. And so it's really a 360-degree process nowadays.
Yes, because if you don't do that, what you have to do is you have to pull your pants over the muffin top. That's what I do. Just tuck it in to your pants and wear a big, thick belt.
And then it becomes a cake.
Then it's a cake. I'd rather eat cake anyways. Okay, let's talk a little bit about the mommies out there. Should you consider a tummy tuck if you are still thinking you might have another child?
I generally recommend to patients, you know, have childbearing years finish. Ideally, because then we can restore your tummy to its formal glory even better, and it'll actually be the tightest part of your body for the rest of your life. You may, the face may sag, you may get droopy, but you'll still have a 25-year-old tummy forever. Right. So as long as you maintain your weight within 10 pounds of that surgery weight, and but let's say you got married again, or you had another child, you know, you will stretch the tummy out, but it'll be back like you had your first child. And many women recover from the first child. It's the second or third one that does their tummy in. So even if you had another baby, it's usually not disastrous to a well-done tummy tuck.
Okay, then let's talk about what happens if you just gain weight. You've done the tummy tuck and you gain weight again. Well, does your skin stretch out again?
Yeah, so normally if you gain a lot of weight after a tummy tuck, a lot of the fat's already been contoured, so the fat has an annoying way of going to where you don't want it. So it'll go to your bum, your hips, your thighs, areas where you didn't have it before. It never goes to your breast or your face. It always goes somewhere else. And so, you know, it usually won't ruin the tummy, but it'll ruin the slimming effect of your flanks or the contour shape that you've achieved through surgery. So weight maintenance within 10 pounds of your surgery weight is usually a good principle.
Okay, let's talk a little bit about cost. How much would that run you if you wanted, let's say, the little tummy tuck or the big tummy tuck?
Yeah, so a mini tummy tuck, which is C-section size or less, and a little flank contouring, is going to be under $10,000, between 5 and 10 depending on the practice. A bigger transformation is going to be over $10,000 but less than a Prius. Like that.
Okay. Okay, that's one way to put it. Okay, so try not to gain the weight. Your stomach is going to come back out again. Would you ever do this twice? Would you ever go in for a tummy tuck, gain the weight, and then go in for another tummy tuck? Or is that just getting dangerous now?
I've been doing this almost 20 years now. I can't actually recall redoing a tummy tuck. So what often will happen is someone accidentally gets pregnant again after a tummy tuck.
Yeah,
and they have a little bit of loose skin, and so you can do a little tiny thing at the bottom or some lipo type contouring. It's very unusual, even after a baby, after a well-done tummy tuck, to have to redo it all again.
Okay, good stuff. Dr. Mulholland, that was a great before and after we just saw. You've brought down gift bags. This is amazing. Full of skincare products, including a serum and a gentle cleanser, all from Vivier Skin, plus a gift certificate to Spa Medica. The entire bag valued at $400. Yes, thank you very much to Dr. Mulholland. Good work. Thanks for chatting with us. Let's go to break. It's Makeover Madness. Stay with us. That is so interesting. Off the top, we're very happy today to have Dr. Steve Mulholland here, and he had a client named Dale. When Dale came to see him, she wanted her pre-baby body back. Can you relate? I can. Let's watch her transformation right now.
Hi, good morning, Dale.
Hi.
Hi, Dr. Mulholland's ready to see you.
Great.
Okay, so come on back.
Hoping that I can get back the figure that I had before I was pregnant, because I found that after the pregnancy and breastfeeding, I lost all the volume that I had in my breasts. Now they just sag. And then around the middle as well, I feel the skin's really stretched out, and I'd like to be able to tighten up the skin in there a little. But I am working out 3 to 4 times a week, running, doing the sit-ups, the weight training, but it's just not showing in my body overall. I find there's just those certain areas that I'm not getting.
On the tummy, just bend down just a bit. That loose stuff right here is where we're going to do some tightening. We're going to do some subsurfacing or subdermal laser tightening, and we're going to remove a little bit of that skin and tighten that for you. As with many young moms who have had their children, it's not so much about trying to look younger. It's just trying to recapture some of the body they used to have. You expand, contract with pregnancy, and you wake up one day, your kids are off to school, and you look in the mirror and it's like, usually what I recommend is a nice teardrop-shaped cohesive gel implant. And then we do what I call a smart lipo-assisted mini tummy tuck, meaning we only use the C-section scar. We remove a little bit of skin, and we do what's called smart lipo up on the tummy and the hips, which is using a laser to melt the fat and to tighten the skin at the same time. So we get a nice, tighter tummy, very little scar, very little downtime, and a nice breast shape.
So many of us have been in that same situation. And, you know, my answer is after you have a baby, just never bend over and never sit down. And then your stomach is always totally flat.
It's a cheaper solution.
That's a cheaper solution. But your solution works very well. When we see the afters, we're going to see sort of the full effect. How often do you get women in that same situation?
It is probably the most common patient I see. A woman between 27, 28, and 45 to 50, had 1, 2, 3, or 4 children, has devoted her life to reproductive medicine, and now looks in the mirror and wonders where her body went. So it's almost like aesthetic reconstruction. It's trying to recreate or grab onto what one once had, a tight, firm tummy and body, and breasts that match your figure.
Is it ever doable? Like, are we ever really able to get back to that tight tummy without a little bit of help?
It can happen. We can get very close to that 25 to 28-year-old figure you had pre-baby. We've got a lot more aesthetic solutions, a lot simpler solutions. It's been an amazing renaissance for the postpartum mom.
Now, for her, she said that she had worked out and everything, but there was always a little something, and she had had a C-section. Does it make a difference, do you think, whether it's a C-section or it's a different sort of birth, a vaginal birth? Does that make a difference in terms of the elasticity in your stomach?
I don't think it makes a difference on the condition of your tummy post-baby. Some of our incision ports or access positions are easier with C-section, but whether it's normal vaginal or C-section, the common complaints are loose skin, stretch marks, no muscle tone, and this pot, this bulge with a little bit of fat and loose skin you can't exercise away, or breasts that have just deflated in front of your eyes, and so you wear an evening gown and there's always that little wrinkling and no fullness up top, or you wear an underwire push-up and there's nothing to push up, or you just want to wear a tank top with nothing on underneath and there's nothing there.
Are you kidding me? With nothing on underneath?
Absolutely.
Yeah, those days are over for me, my friend. I remember them, though. So what I found interesting about that tape is that you said you actually go through the C-section incision. So
you know, the common points that we go in to do this smart lipo or tummy tightening with lasers and probes, the belly button, through pubic hair, through C-section scars, so very unobtrusive. Certainly more so than it used to be with the big tummy tuck scars.
Right.
The breast implants, we're going to talk about that later, but there's many stealth ways to go in and bring back that volume.
Excellent. Well, you did a really, really good job. So Dale, as we mentioned, wanted to restore her body to her pre-baby look. Let's take a look at the results.
Dale, it's so good to see you. You too. How are you? I was just looking at your pictures and admiring your post-op outcome. Come on in. Let's have a look at them. So Dale, it's 8 weeks after your surgery. What do you think?
I love it. I think it's great. I couldn't be happier. And yeah, no complaints at all.
If you look at the pre's, you can see it was difficult for you to fill a bathing suit.
Definitely,
and
yeah.
We've got a nice little post picture here. It looks like a natural breast.
Yeah,
it doesn't look
definitely.
fake.
I feel great right now. Honestly, though, I think for the first couple weeks before surgery, I was on an emotional roller coaster. Of course, I was usually excited and couldn't wait to have the surgery done. But there's also a lot of times when I was feeling really anxious, very nervous, and almost getting cold feet at some points, mainly because I'd never had surgery before, and I didn't know what to expect. I was worried about what the results were going to look like, but also worried about the recovery, worried about any possible complications. But now, 2 months later, I am so glad I had the surgery done. This body makeover was probably one of the best things I could have done for myself. I love the results. I think that Dr. Mulholland exceeded my expectations. I had hoped to regain back the fullness that I had before pregnancy, and I think my body's even better than it was before I was pregnant. I love it. I had my 40th birthday this summer, and I think I look better than I did in my 20s.
Now that's good work. She feels better than she did before the baby. That's amazing. So you've got some befores and afters here.
Yeah, I think this really highlights and will resonate with any woman that's had children. You know, that bent over and it's kind of a little loose.
Yeah.
That's very easy to fix now. So, under local anesthetic, that's the other thing. You don't need a general. You don't need to stay overnight. It's very quick, relatively painless. This little post-mummy tummy, usually below the belly button or the little wrinkles above, and when you bend over, it's loose. It's just not as sexy as it once was. So as you said, you never bend over and you never sit down.
Sit down, like I am right now.
This is her bent over view after. You see it's nice and tight, more pre-babyish. And you know, I think having children is great. Sometimes it ravages the body, and we should take pride in being moms and dads. But you don't have to live with the consequences of childbirth anymore if you don't want to.
Well, the other thing is you're going through so much hormonally as well. It's really tough to get used to your new body. So it's nice if there is something that can help you sort of get back to the way you were, the way you liked your body. How long did she wait? After she gave birth?
Yeah, she was about 4 or 5 years after. I mean, she worked out and dieted, hoping, as many women do, I can do this. I can exercise through my loose skin, stretch marks, and that little roll. And so I never advocate doing any kind of procedure within a year of breastfeeding. Not just childbirth, but finish the breastfeeding, because that estrogen progesterone has an effect on your skin. Right. So that all the dust settle, that everything just deflate, droop, and sag. Try your best in the gym, and some people do. They have surprising genetic code, and their skin looks great after children, but some don't. And so wait a year, see a cosmetic plastic surgeon you feel comfortable with, who offers you minimal invasive and options in restoration. So 1 year.
How long for recovery for her? Or in general?
You're up and walking that day nowadays. You're up and moving that day. Nothing heavy lifting for 3 weeks, but you're back to your normal lifestyle within a month.
All right, you have brought down a fantastic gift for everyone in the audience. I think you're really going to like this. Dr. Mulholland has brought down a $100 coupon, and some Spa Medica skincare products for everyone in the audience. So if you wanted to, you could go and get one of the non-invasive procedures, put this towards anything you want. Thank you so much. That was a really good lesson.